Hi everyone, this is Dr. Rukmani Choudhary and you're watching Dr. Rukmani's Health Update. My today's topic this is pretty common. In today's video, I'll be talking everything about Rosacea, like why this happened, what are the subtypes, and what are the symptoms, what are the signs, and prevention part, how you can control this condition, how you can manage this condition, best effective homeopathy medicine. So you're requested to watch complete video. For complete information, if you're watching first time, please like, share and subscribe my channel for further notification. So let's start. What is Rosacea? So Rosacea, as the name suggests, redness. Redness is there, swelling is there, and there is a swelling, flushing means there is a redness, swelling, and at times burning is there. So these are the trademark symptoms of Rosacea. Like you can have burning, you can have swelling, and there is a flushing means redness of the face, and that is patchy redness. You can see there are broken blood vessels. So these are the symptoms or the signs of Rosacea. Now what are the types? What are the subtypes of the Rosacea? There are major 4 subtypes of the Rosacea. Subtype 1. Subtype 1 is usually associated with your broken blood vessels. Means your fine blood vessels these are like broken. So you have purplish or bluish appearance of your cheeks, on your cheeks. There is swelling. Obviously there is swelling and there is redness. And in subtype 2, papulopustular rosacea, as again name implies, papulopustulous means you have acne. This is also called acne rosacea. So you have pimples, you have acne, and the skin is elevated, there is a swelling, and again blood vessels are broken. But you have acne, prominent acne are found in these conditions, and these are usually found among women. And the third one is Rhinophyma rosacea. Rhinophyma, this is like thickening of your nose. So you have thickness of your nose skin, and this is usually found among men. And at times there is thickening on forehead, thickening on cheeks. These are also seen. So, and the last one is ocular rosacea. Again, name implies, ocular means eyes. So the symptoms are centrally associated with eyes. You have burning, there is a grittiness of eyes, and you have cyst in your eyes. At times there is a watery, dry. So eye symptoms are found in ocular rosacea, and this can happen that you have multiple rosacea. So you can 2 subtypes can coexist, and usually Rhinophyma rosacea coexist with the other subtype. So these can be coexist with each other, means you can have more than one rosacea at a time. So exact cause that this can cause the rosacea, no, there is no exact cause, there is no determined cause. But yes, there are some theories that some environmental factors and some genetic factors contribute to have you rosacea. So these things can be there, and there are certain aggravating or risk factors that if you're having spicy food, if you're eating chocolate, eating tomato, citrus fruits can aggravate your condition, and having alcohol at times can aggravate your symptoms. So these things can aggravate. Sun exposure, and rubbing and exfoliating even can aggravate. And at times there is a bacterial infection, and that is H. pylori, bacterial infection. This can even at times can aggravate your symptoms. Our age bracket, that 30 to 50 years is the age bracket that you may have, more aggravated form of this. How you can control this condition, and can you manage this rosacea? Yes, certain steps that if you use alcohol, so just avoid, just limiting alcohol, limiting coffee, any items like chocolate and tomato, citrus fruits. These things can be avoided, and you can do gentle massage. What role homeopathy offers in rosacea, and what are the medicines, best effective homeopathy medicine? See, homeopathy always focuses on individual approach, totality of the symptoms, like you are having this problem and what other symptom you have, means totality of the symptom. If you have multiple rosacea, like you are having 2 subtypes or more than 2 subtypes, so we have to consider all these things. Just if you're watching on YouTube, you can find all these medicines link in description box below, but don't buy all medicines, not required. Just focus on your symptom and your subtype, that what subtype do you have, and you can use medicine accordingly. I'm starting with the subtypes, that these are the subtypes, and accordingly these are the symptoms and the medicines. So subtype 1, as in subtype 1 we have flashing, we have redness, there is a swelling of your face and particularly on your cheeks, and there is a patchy redness. So this is like a broken blood vessel. So in homeopathy, there are different medicine, like there is carbo, there is lacasis, and agaricus and belladonna. These 4 medicines covers all these symptoms. But again, in agaricus, I'm having agaricus here, and again you have you are having redness, there is a cold sweat and cold aggravation, means you have winter aggravation. So your symptoms are aggravated during winter, so you can use this medicine. These are the oral form of the medicine. You are supposed to have these medicine orally, and all medicines link in the description box below. 1 or 2 drops twice or thrice before having your meal. So just have agaricus if your symptoms are aggravated during winter. Belladonna is pretty common in congestion, redness, flushing, flashing of face. So this is pretty common. But belladonna symptoms is that you are having, along all the symptoms, like you are having redness is there, swelling is there, and patchy redness, congestion, but you are having heat. When you touch, there is a heat and aggravation in the heat. So these are the symptoms that are covered up by belladonna. Almost specific. All trademark symptoms are found in the Carbo. So Carbo is a domestic medicine. You must be knowing about its gastric property, that for the flatulence is known for the flatulence and gas formation in homeopathy. But this is like again polycrest medicine, deep acting remedies, and this works amazing in rosacea cases. If you're having rosacea, means there's a broken blood vessel, there's a purplish or bluish appearance on your cheeks, on your face, have this medicine, and 30 or 200 potency. These are for the clinical purpose. Go with the smaller quantity and with the lower doses. 1 or 2 drops twice or thrice before having your meal, and just use it regularly. This is again given when you have bluish or purplish appearance, even blackish, means there is a dark bluish appearance. So in that case, you can use lacasis. Lacasis is known for its hemorrhagic property, means bleeding tendency. So if you have bleeding tendency, means there is a broken blood vessels. Fine blood vessels are broken, means there is a fine hemorrhage, tiny hemorrhagic blood vessels. So you can use this medicine in that case. These are given in the subtype 1. The subtype 2 is like acne. Papulopustular rosacea, means you are having acne. So in this case, Sarsaparilla works amazing. Sarsaparilla is given, so Rhinophyma is given. Use Sarsaparilla. Sarsaparilla you must be knowing for its acne property. That this is given, acne, pimples. So this is a very good medicine in acne rosacea, we can say, or papulopustular rosacea. Subtype comes Rhinophyma rosacea, means you're having thicker nose skin. So in this case, hydrocotyle is given, thuja is given, and sarsaparilla. These medicine are given. Rhinophyma rosacea or thickened skin. So these are the medicine. So thuja is given, and there is a sarsaparilla detox your skin. So and the last one is ocular rosacea. So ocular means related with your eye. All symptoms are associated with your eye. So in this case, euphrasia is given, euphrasia, cantharis. So these are the medicine that is given in ocular rosacea. You are having gritty eye, cyst in your eye. Two prepared medicine, that is one is Formula D, that is Baxen's Formula D, and it is given in all skin problem where you are having the swelling, inflammatory skin conditions. As in rosacea, we are having swelling, redness, and there is a flushing. So you can use this medicine in the tablet form, 1 or 2 tablet twice or thrice before having your meal, and just use it regularly. 2-3 times in a day, and like 2-3 weeks onward. Rest depends on your symptom improvement. This is a very good remedy in acne rosacea cases where you having redness. Again, there is a acne rosacea. So in those symptoms, you can use this medicine. This is in the liquid form, drop form. So just 5-10 drops in some lukewarm water, and just have twice or thrice. And you are not supposed to buy all the medicine. Not needed, not required at all. Just go with your case, just go with your subtype. What subtype do you have accordingly, and what other symptom you have. In homeopathy, it does matter that what is the totality of the symptom, what other symptoms. So hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much. Thank you.